Welcome back, everyone, to the Deep Dive. This time, we're going to be diving into AI and mental health.
Oh, fantastic.
Yeah, it's a really important topic, especially with everything going on these days.
Right.
And we were talking a little bit before the show started, just how much mental health support is needed around the world.
Yeah, I think the statistics are pretty shocking when
Yeah.
you really look at the millions who are struggling.
Yeah, and the lack of
Yeah,
professionals to
exactly.
treat them.
And the huge gap there.
Yeah,
So I think AI might be part of the solution, or at least part of it.
yeah, definitely. I think we're already seeing it pop up in a lot of ways, maybe in ways that we don't even realize yet.
Absolutely, yeah.
So should we just jump in and
Yeah, let's do it.
start talking about it?
Right.
Okay, so I was doing a little bit of reading in preparation for this deep dive,
Okay.
and I came across this company called Cogito. Have you heard of them?
I have, yeah.
They're using AI to analyze voices. It's like an emotional lie detector, which I think
Yeah.
is really fascinating.
Got-
Yeah, that's right. What they're doing is they're listening for those subtle changes in someone's voice that can indicate their emotional state.
Okay.
Things like tone, pace, volume, maybe things that we wouldn't necessarily pick up on.
Right.
But AI can detect those patterns and those really small changes.
So it can hear the stress in your voice, even if you're trying to hide it.
Absolutely. And they're finding that these cues can be really helpful in identifying, depression, anxiety, even things like burnout.
Wow, that's really wild.
Yeah.
I mean, I think about especially phone calls I've had, where you're trying to sound really cheerful, but you're kind of stressed out.
Yeah.
And it makes me wonder if they could tell that, you know what I mean?
I think so. Yeah, absolutely. That's the kind of thing Cogito is designed to detect. I mean, they're using it, in places like call centers now to support employees
Wow.
and even clinical settings, maybe to help therapists monitor patients.
That makes me wonder, what other information is hidden that we don't even realize in the way we talk or in the way we act.
Absolutely.
It's a little scary, right?
It is a little bit Big Brother-ish, but
Yeah.
could be used for good.
Yeah, I think so. So then, talking about information that's hidden, I was reading about IBM Watson. Are you familiar with this?
Yes, very familiar.
They're using AI to analyze behavioral data. I mean, this sounds like something straight out of a movie.
It does, yeah. So IBM Watson is designed to just go through massive amounts of data.
Oh, wow.
So think like social media posts,
Okay.
text messages, even health records.
Okay.
And it's looking for patterns
Oh, wow.
that could indicate, mental health issues.
So, are they seeing if you're posting less often?
Yeah, it could be things like that. It could be
Or, the words you're using?
the words used. Yeah, exactly. Or who you're interacting with.
Oh, wow. That's so interesting.
Yeah. And by analyzing all of that, how we communicate and interact online,
Yeah.
it can potentially pick up on those early warning signs.
So it's almost like a detective looking for clues.
Yes, exactly. It is. It's looking for those digital clues and those digital breadcrumbs.
It's a little unnerving.
It is. It is a little bit.
But also, I guess if it can help people, it's great.
Yeah, and that's the hope, right?
Yeah.
That it's identifying potential issues early on when things can maybe
Be treated.
be treated more easily, exactly, and interventions might be more effective.
That makes a lot of sense. So this is all about being proactive.
Exactly, exactly. Moving towards that proactive approach to mental health care.
Early intervention is so important for a
Changing.
lot of things.
Yeah.
And it sounds like mental health is no exception.
Yeah, I think in the past, it's always been so reactive, waiting till things get really bad.
Right.
And now we have the tools to actually, like you said, be proactive and detect
Oh.
those subtle shifts.
Yeah, and it sounds like AI can do that even better than humans can sometimes. So this is all really fascinating. So we've talked about voices, we've talked about data. I also read a little bit about facial recognition being used for mental health. Is that right?
It is, yeah. There are some companies out there like Effectiva,
Okay.
and they're developing systems that analyze facial expressions to gauge a person's emotional state.
Oh, wow.
So it turns out even those really tiny micro movements in our face can reveal a lot about how we're feeling.
So it's like reading our faces like a book.
Exactly. It's like AI is learning to read our faces like we do.
That's incredible. I can see how that would be really useful in therapy.
Yeah, absolutely. So imagine using facial analysis during a therapy session,
Right.
to gain a deeper understanding of your patient's emotional responses,
Yeah.
or even to track their progress over time.
Wow.
So it can be really, lead to much more personalized care.
So they're basically able to see how you're reacting
Exactly.
to whatever they're saying to you. That's really interesting. So it sounds like AI is getting really good at understanding human emotions.
It is.
I mean, we've talked about, through our voices, through our faces, and through our data.
Yeah.
So is that where all the AI-powered therapy tools and chatbots come in?
That's a big part of it, yeah.
Because it seems like they're everywhere these days,
They
right?
are popping up everywhere, yeah, and for good reason.
Yeah.
You've got things like Wobot, Wysa.
Okay.
These are chatbots that are really making therapy much more accessible and convenient.
Right.
They're available 24/7. They're right on your phone.
Right.
And they can offer a level of privacy that some people really appreciate.
I can see that being really appealing for some people, especially those who, maybe they can't afford traditional therapy.
Right.
Or, maybe it's just not accessible where they live.
Exactly.
Or maybe they're just more comfortable talking to a bot.
Yeah, and therapy can be really expensive and time-consuming.
Yeah.
And it's not always easy to find the right therapist for you.
Yeah.
So these chatbots, offer that instant support, and they're also based on proven therapeutic principles.
Oh, that's really good. I didn't realize that.
Yeah, like CBT, cognitive behavioral therapy.
So it's not just like a random bot. It's actually based in...
No, it's not. It's really designed with specific therapeutic goals in mind.
Oh, okay.
And for things like mild to moderate anxiety and depression, the research is showing that they can be surprisingly effective.
That's really interesting. I never thought about using technology for that kind of support, I guess.
Yeah,
Makes you wonder how far it can go.
absolutely.
So how do these chatbots work? Like, do they really talk to you?
Yeah, so they're interactive. They guide users through exercises. They provide coping strategies.
Okay.
They even offer feedback based on your interactions with them.
So it learns as it goes.
It learns as it goes, yeah. So it can really tailor the support to you,
Wow.
which I think is really important.
So it's really like having a therapist
Yeah, in your pocket.
in your pocket. Yeah.
Exactly.
That's really incredible. And especially I imagine for people who just don't have any other access to support,
Right.
it could be a real lifeline.
Yeah, absolutely.
So it's almost like AI can be a mental health support system in and of itself.
Yeah, absolutely.
That's really cool.
Yeah.
And then I know we were talking about some more serious issues, and I know AI is being used for suicide prevention, which I think is so important.
Yeah, it's crucial. I think suicide is such a major public health issue,
Right.
and we need all the tools we can get to prevent it.
Yeah, definitely. So how is AI being used there?
Well, there's an organization called Crisis Text Line. Are
Okay.
you familiar?
I've heard of it, yeah.
Yeah, so they provide this 24/7 texting service for people who are in crisis.
Okay.
And they're using AI to analyze messages
Okay.
and to figure out who needs that immediate help.
So it's almost like the first responder in a way?
It is. It's like the first line of defense.
So it can tell what's a serious message and what's not.
So it can detect keywords, phrases, things that indicate suicidal thoughts
Okay.
or self-harm, any kind of serious concern.
Right.
And then it can alert the human counselors so they can intervene quickly.
So it's kind of like a safety net.
It is. It's like a digital safety net.
Making sure no one slips through the cracks, which is really, really important.
Yeah, it's really amazing what they're doing.
And then I also read a little bit about how they're using AI to monitor social media for, I think, suicidal ideation and bullying and that kind of thing.
Yeah, that's another area where it's being explored.
It's interesting. It's almost like a double-edged sword, right? Because it could be helpful, but it's also a little scary.
Absolutely, yeah. I mean,
Yeah.
it's a sensitive area.
Yeah.
Social media can tell us a lot about people's emotional states,
Right.
but it's also a huge and complex landscape to navigate.
Yeah, exactly.
So AI can help scan posts, and look for those signs of distress.
Okay.
So like expressions of suicidal thoughts or self-harm or even, bullying.
So it's like a digital detective
Yeah.
looking through everyone's posts.
Yeah, it is. It's a little creepy, but
But it could also be really helpful, like you said. I mean, it could prevent...
yeah, if it's used the right way, it could prevent some real tragedies.
Right, exactly.
It's all about using it responsibly,
Mm-hmm.
and we need to think carefully about all the implications.
Yeah, definitely. It's clear that AI is already impacting mental health in a lot of ways that, I think we're only going to see that increase.
Absolutely.
So this is really just the tip of the iceberg, and I'm really excited to keep talking about this.
Me too. I think there's so much more to uncover.
Yeah, especially when it comes to, the ethical considerations and the potential risks, but also the amazing opportunities.
Absolutely. Yeah, it's a really exciting time to be talking about this.
So let's keep diving in and explore all the different sides of this, the good and the bad,
Okay, sounds good.
and really get a better understanding of what AI means for the future of mental health.
I'm looking forward to it.
Me too. So what should we talk about next?
Yeah, it really is amazing to think about, all the ways AI could make mental health care more accessible.
Yeah, for sure. And that's one thing I kind of wanted to ask you about because, therapy, traditional therapy can be really expensive and time consuming.
It is a major barrier for a lot of people.
Yeah.
And I think, that's one of the biggest areas where AI could really make a difference.
Yeah.
Because you think about those tools we were talking about earlier, the AI-powered tools and the chatbots,
Right.
they can provide support at, a fraction of the cost of traditional therapy.
Right.
And they're available whenever you need them, regardless of, where you are.
So it's like having support available 24/7,
Exactly.
which is incredible, especially for people, who are really struggling or if they're in
Right,
crisis.
especially if you're in a rural area,
Yeah.
and there aren't a lot of therapists around.
All right. Or,
Uh,
maybe you can't afford it or you're not sure where to even start.
It can be really overwhelming.
Yeah. So it feels like it could really help level the playing field when it comes to mental health care.
I think so too. I really do.
And, beyond accessibility, I was also thinking about personalization.
Yes.
Like how AI could potentially tailor treatment to each person's individual needs.
Absolutely. And that's another huge area where AI is really showing a lot of promise
Yeah.
because, it can analyze so much data.
Right?
Everything from your genetics and your lifestyle to even your real-time emotional responses
Oh, wow.
to create this, really customized mental health plan.
So it's like having a therapist who knows you inside and out
Exactly.
and can offer support that's, perfectly tailored to your situation.
That's the idea.
That's really cool. I like that. And it seems like, AI could really change the game when it comes to preventative mental health care, too.
Oh, absolutely.
Because right now it feels like we're always waiting for symptoms to appear before we do anything.
Right. We wait for the crisis.
Right.
And then we try to react.
Yeah.
But with AI, we could actually identify potential risks early on
Okay.
and intervene before, issues even escalate.
Yeah, and we were talking about all that data that AI can access. I mean, you think about wearables and social media activity and even voice patterns. I mean, there's so much information there that AI could use to, detect early warning signs.
Right. It could be like a smoke detector for your mental health,
I like that analogy. Yeah.
alerting you to potential problems before they get out of control.
Right. And the more data AI has, the more accurate those predictions become.
Exactly.
Which is exciting, but it also makes you think about all those ethical considerations we were talking about earlier.
Yes, definitely. There are always two sides to the coin.
Right.
So we have to be mindful of that as we explore these new technologies.
Yeah, and I think, it's important to remember that AI isn't meant to replace human connection,
Absolutely not.
especially when it comes to something as personal as mental health.
Right.
I mean, a chatbot can't give you a hug or offer, that same level of empathy as a human therapist.
Exactly. And I think that's something we need to be really careful about
Right.
because technology can be amazing,
Yeah.
but it can also be dehumanizing if we're not careful.
Right. So how do we strike that balance?
That's a really good question.
Yeah.
I think the ideal scenario is one where AI and human therapists work together.
Okay.
So you're kind of leveraging their unique strengths to provide the best possible care.
Like a partnership
Exactly like a partnership.
where AI handles the, data analysis and the routine tasks.
Right. All the stuff that AI is really good at.
Right. And that frees up human therapists to focus on things like
Building relationships,
Yeah.
providing emotional support.
Right. So it's not about replacing the human touch. It's about using AI to augment it.
Exactly. And that's where I think the real magic can happen.
Yeah, I like that. Okay, so I think we've talked a lot about the positives,
Yes,
but we also need to talk about the potential risks and the ethical concerns.
absolutely. I think that's crucial.
So let's dive into those a little bit.
Okay.
One big worry people have is about privacy.
Yes, privacy is huge.
I mean, we're talking about really sensitive information.
Right.
Our thoughts, our feelings, even, our darkest fears
Yes.
being fed into AI systems.
That's something we have to take very, very seriously.
Yeah.
We need to make sure that this data is protected and used responsibly.
Yeah, and that there's transparency and accountability.
Absolutely.
Yeah.
People need to know how their data is being used,
Right.
and they should have control over who has access to it.
Right. And I know there have been some, issues with some tech companies and how they've handled health data.
Right, and that makes people understandably nervous.
Yeah, for sure.
So I think, it's crucial that we establish clear guidelines and regulations
Okay.
to protect mental health data.
Right.
This technology is still relatively new,
Right.
so we really need to have those safeguards in place.
Yeah, that makes a lot of sense. So privacy is one big one. Are there other ethical considerations that we should be thinking about?
Well, one thing that some people worry about is the potential for unintended consequences.
Okay, like what?
Well, for example, some people worry that relying too heavily on AI for mental health support
Okay.
could actually lead to a decline in human interaction.
Oh, that's interesting.
Yeah, and social connection.
Because we're already seeing that in a lot of ways with technology, right?
Exactly. We're spending more and more time online,
Yeah,
less time interacting face to face.
right.
So it's really important to make sure that technology complements human connection
Yeah.
rather than replacing it.
So finding that right balance is key.
It's a delicate balance for sure.
And it makes you wonder how, AI might be used in the future.
Right.
I mean, it's changing so rapidly.
It is. It's hard to even imagine what's next.
So what do you think is next? What are some of the things you've been reading about?
Well, one area that I think is particularly interesting is brain-computer interfaces, or BCIs.
BCIs, those sound like something out of a sci-fi movie.
You do sound very futuristic.
Yeah.
But they're actually becoming increasingly real.
Oh, wow.
So basically, BCIs allow individuals to interact with computers and other devices
Okay.
using only their thoughts.
Whoa.
So you can imagine, controlling a prosthetic limb with your mind,
Wow.
or even communicating with loved ones if you're unable to speak.
That's incredible, but how does that relate to mental health?
Well, researchers are exploring the use of BCIs for something called neurofeedback therapy.
Oh.
And this is where individuals learn to regulate their brainwaves
Oh, wow.
to improve their mental state.
So it's like a high-tech form of meditation.
It is. It's like biofeedback on steroids.
So could we potentially use BCIs to treat things like depression or anxiety?
Yeah, potentially by directly influencing brain activity.
That's mind-blowing.
It is. It's really exciting. It's like opening up a whole new frontier in mental health care.
Wow. And that's just one thing that's coming down the pipeline.
It's just one thing.
I mean, who knows what other incredible breakthroughs are just around the corner.
Right, and it's happening so fast.
Yeah. And I've also heard about AI being used in virtual reality therapy.
Yes.
Is that right?
Yeah, that's another really rapidly growing field.
Okay.
It allows therapists to create these immersive, interactive environments
Okay.
that can be used to, address all sorts of mental health challenges.
So like using VR to help someone overcome a phobia?
Exactly, like
Yeah.
a fear of spiders or heights.
Okay.
And the AI can actually enhance these experiences by tailoring, the environment and the challenges
Okay.
to each person's needs.
So it's like a personalized therapeutic world.
Exactly. It's like having your own virtual therapist.
That's really cool. I like that. And then there's the whole concept of predictive mental health, which we touched on earlier.
Yes.
It's a little unsettling, but also really exciting.
It is. It's like peering into a crystal ball.
Right.
But the idea is that AI will be able to, analyze all this data
Right.
from our genetics and our online behavior to our physiological responses
Okay.
to predict mental health risks before they even manifest.
So we could potentially identify individuals who are at high risk for developing depression or anxiety and intervene early before the condition takes hold.
That's the hope.
That could be life-changing.
It could really transform mental health care as we know it.
Wow, so it's a future that's full of both promise and peril.
Absolutely.
And it's really up to us to figure out how to navigate it.
It is.
Wow.
We have a lot of important decisions to make.
Yeah, and a lot to think about.
Yes, definitely.
But it's also really exciting.
It is. It's a very exciting time to be alive.
It is.
Especially if you're interested in this intersection of technology and well-being.
Yeah, it does feel like we're on the edge of like a whole new world.
It does, yeah. Like a paradigm shift
Yeah.
in how we think about and approach mental health care.
So where do we even go from here? We've talked about, it seems like there's so much potential for AI to really improve mental health care.
Right.
But we've also talked about some of the risks and the ethical concerns. So how do we move forward responsibly? How do we navigate all of this?
It's a big question.
Yeah, it is a big question.
And there's no easy answer.
Right.
But I think, one of the most important things is to stay informed
Okay.
and engaged.
Okay.
The more we understand about AI and how it's being used,
Right.
the better equipped we'll be to make those decisions,
Right. So it's all about education.
Yeah, education's key.
Being aware.
Absolutely.
So what can our listeners do to stay informed? Are there resources? Are there websites?
Yeah, there's tons of great resources out there.
Yeah.
Obviously you can start by reading articles, listening to podcasts
Right.
like this one, hopefully.
Of course, yeah.
But there's also some really great books out there.
Okay.
Documentaries that delve into the ethical and societal implications of AI.
Okay.
And Don't be afraid to ask questions,
Right.
If you're using an AI-powered mental health tool,
Yeah.
find out how your data is being used, how it's being protected.
Yeah. Transparency is so important.
It's crucial.
It really is. And accountability.
Absolutely.
It's all about, being an active participant
Yeah.
in shaping the future of this.
Not just passively consuming information,
Right.
but actually being a part of the conversation.
So it's collective responsibility in a way.
It is.
It's not just on the researchers and the developers.
Right. It's on all of us.
It's on all of us to kind of figure out.
To figure out how to use this technology responsibly.
Right, for the greater good.
Exactly.
So as we kind of wrap up our deep dive into this world, it's been a fascinating conversation.
It has.
I feel like we've only just scratched the surface.
Oh, absolutely. We could talk for hours.
We could talk for hours. Maybe we'll have to do a part 2 of this deep dive.
I'd be happy to.
But I want to leave our listeners with something to kind of think about.
Yeah.
So imagine a world, right, where AI is just seamlessly integrated into our lives.
Okay.
And it's providing, personalized support, early detection of risks,
Right.
and tailored interventions.
Yeah.
So what role do you see AI playing in your life?
Wow. That is a really good question.
It is something to think about.
Yeah. And I think it's a question we all need to be asking ourselves.
Yeah, because it's coming, whether we like it or not.
It is. It's already here.
It's already here.
But it's going to become even more prevalent in the years to come.
So it's all about, making those decisions.
Yeah, making conscious choices.
Or how we want to use it.
And how we want to let it shape our lives.
Exactly.
And our world.
Well, this has been an amazing conversation.
It has. I've really enjoyed it.
Thank you so much for joining us.
Thank you for having me.
And for sharing your expertise.
My pleasure.
And thank you to all of our listeners for tuning in to The Deep Dive.
Yes, thank you.
We always say it, but stay curious.
Stay curious.
Stay informed.
Stay well.
And we'll see you next time.
See you next time.